name is Kari Hexem. I am an assistant professor at Penn Dental Medicine in the Department of Restorative Sciences and the Division of Community Oral Health. I'm a general dentist, and I enjoy working with people who don't really like going to the dentist very much. Often I found that people have a very good reason for not liking going to the dentist, which is that at some point in their life, they've either had a bad experience at the dentist or have felt very badly about the state of their mouth. I teach clinical dentistry at one of our community sites on 54th and Baltimore Avenue, with an emphasis on patient communication and minimally invasive dentistry. And my research at Penn Dental Medicine is about how we as a profession can improve the quality of care we provide for individuals with substance use disorders and other vulnerable populations. Well, first of all, many people have substance use disorders. According to the most recent national survey on drug use and health, between 15 and 20% of adults in the United States have struggled with a substance use disorder in the past year, and 10% of adults have struggled with alcohol use disorder. As medical professionals, we now know that substance use disorders are chronic yet treatable health conditions, in the same way that diabetes and heart disease are treatable chronic conditions. But the definition of a substance use disorder is continued use of a substance despite significant problems related to its use. Most substance use disorders are mild or moderate, which means that these disorders have an impact on your life, but your life is not completely destroyed. You can still get up in the morning and get to work and fulfill most of your responsibilities, but often there are subtle or even considerable impacts on your life. And unfortunately, real health consequences can accrue with habitual substance use. The problem with substance use disorders when it comes to your teeth, especially substances that you ingest through your mouth, is that they are a triple whammy. The substances themselves, whether alcohol or marijuana, opiates or methamphetamines, or even cigarettes, alter the natural balance of microbes in your mouth and make you more susceptible to dental decay and periodontal disease. Some substances, either through their pH or other chemical characteristics, can be even more destructive. And so you combine the destructive aspects of the substances themselves with a tendency to have fewer self-care behaviors and more avoidance of preventive health care, and you can see how dental problems can grow. The most common mouth problems for people with substance use disorders are the same mouth problems that affect all of us: tooth decay, gum disease, dry mouth, infections, tooth pain, and tooth wear. And these can lead to trouble eating, a risk of infections spreading throughout your body, and especially with visible decay or tooth loss, feeling bad or embarrassed about your mouth and smile. There are several ways in which substance use disorders can lead to systemic complications in the mouth. The first is that infections in the mouth can spread. Bacteria from untreated gum disease or tooth infections can enter the bloodstream and affect the heart, lungs, brain, and other organs. Chronic inflammation from gum disease can also make other health problems worse, like diabetes or heart disease. Severe pain or broken teeth can make it hard to eat, leading to poor nutrition and a weaker immune system. And untreated infections can cause serious medical emergencies, like swollen faces, fevers, and hospital stays. Pain and embarrassment from bad teeth can also increase stress, depression, and sometimes make staying in recovery harder. Small problems are easier to fix when caught early, and treating dental issues early helps you feel better, eat better, and stay healthier overall. So it's important to take care of your teeth. We recommend brushing daily, twice a day, with fluoride toothpaste. Even if it feels tough some days, just getting to your toothbrush, getting the paste on it. You don't have to commit to the entire 2 minutes, but, give it a try. And if twice a day feels too much for you, you can try once a day. Or if brushing at the end of the evening never works for you, you can brush during lunch or right after you eat dinner. If you feel like you're brushing really infrequently or you are starting to get dental decay even though you're brushing, we can recommend a prescription strength fluoride toothpaste that can be even more effective in preventing dental decay. We also recommend drinking lots of water, which can help with dry mouth and additionally help keep your mouth clean, and chewing sugar-free gum to boost saliva if your mouth feels dry. And very importantly is getting regular dental checkups, even if you don't have any pain. Catching problems early makes a big difference. And tell your dentist about the challenges you have with taking care of your teeth. We can help make a care plan that fits where you're at right now in your life. During dental exams, with our bright lights and dental x-rays, we can often see early warning signs of things going wrong in your mouth. The start of tooth decay, worsening gum disease, any mouth sores, and the dryness of your mouth when you have your mouth open for an extended period of time. And then we can start a conversation, asking you about your health habits to better understand where you're at right now and support your care. We also can connect you with help, referring you to medical providers, counselors, or even recovery programs if you feel like you are ready.